Typical working days could be anywhere like a 15 to 20 patient. The condition can be various. Sports injuries, pediatric condition, dermatological, some internal conditions such as migraine, or maybe PMS.
Okay. How does sports medicine differ from standard medicine?
The sports medicine I'm practicing is I call integrative. That means, in a sense, we can do Western or conventional medical assessment. And in case the patient has a torn ligament or maybe fracture, we can order X-rays, and then that was, you know, commonly done, also at the ER, maybe like urgent care, right?
Yeah.
And then on top of that, we can also offer a quick pain relief, such as acupuncture and I guess immobilization and also soft tissue work to reduce the swelling, and the patient often just feel better very quickly, and the function probably will be restored very, sometime immediately.
Okay. What types of injuries do you usually see, and how do you treat them?
Most of the injuries we see soft tissue injuries like sprains, strains of the muscles, and acupuncture works really well. Can promote blood flow and reduce the swelling and promote the tissue repair. And in case patient who had like a fracture, we order X-ray, rule out, or confirm the fracture, and then we also make a referral to the orthopedic surgeon in case they need a surgery. Yeah.
Okay. What process do you go through to become like a sports medicine doctor? Like what educational steps?
Well, sports medicine is very broad. Sports medicine includes so many different fields, like for seniors, for young, and for women, for men. So I grew up in China, and when I was in medical school, I happened to be an athlete. I was on the school's track team, and also I was involved in soccer, basketball. So I would say kind of versatile, and just because I love sports, and then I want to help the athletes and also some people who are not good in sports, but I think sports or maybe exercise will help their health. So I think that's why sports medicine covers so widely, and then we make people who are really good in sports and to perform better, but also for people who are having health issues, they can benefit from sports or exercise. Yeah.
Um, how did you find out you wanted to pursue this career?
Because I'm always an active person. I was active student in school. I kind of did really well in both academic and also sports field. So that's why I think I should, use my knowledge or my, skills, expertise, helping people to live to the fullest. They should be healthy, active, happy. So I think I want to be that kind of person. So that's why you see I'm a little different from most of the doctors or physicians. Yeah.
Yeah. All right. What are some common misconceptions about sports medicine or sports injuries in general?
I'm sorry.
Like, what are some common misconceptions about sports medicine or like sports injuries in general?
Oh, okay. Well, typically people having sports injury, they will say, oh, you go to ER, you go to urgent care, and then you go to, like a sports medicine doctor. So what is typically done, just, oh, we actually you have no fracture, and then we give you a brace, maybe a boot, and then two crutches, just immobilization. So typical, care is rise, rest, ice, compression, elevation. But that's not enough. So we want to help people who had sports injury to go back to the court, to the field, very quickly. So you need help the tissue heal, right?
Yeah.
So I think we can do a much better job, and we are doing more proactive care instead of just passive care.
All right. What's your favorite part and least favorite part about the job?
Because I can, I can make a lot of people live better life every day. I would say I help people one at a time. I can see I had made huge difference in one person's life, and how their, quality of life, living. Yeah. So that's what makes me feel good about that. I could be a scientist or maybe an engineer. I can make some good devices. I can give drugs to patient, maybe on larger scale. But I don't feel like I have so much, haven't achieved enough compared to what I'm doing now. I can feel like, oh, patient, send me letters, they put a good review on the website, internet, and then so I feel like I have made a positive change, influence in one person, individual person's life. Yeah, so that makes me feel like life is rewarding. Yeah.
Okay. Are there any expectations you had about the job which ended up being different in reality?
There's not much difference because again, I'm trying to be a human being and, like an active person. And then I practice medicine, this is what I preach all the time. So I tell people to be happy, to be healthy, and then to be active, to be fit, right? And then I show my patient, okay, this is what I have done. So I want to be a living model, role model for patient. Yeah.
All right. What are the most important traits you need to have to do well?
The truth.
Yeah, like personality traits.
I think what you can call resilience or perseverance. So a lot of people, beginning of the year, oh, this year I want to be healthy, active, and then most people will start right away after New Year, and then for 1 month, and then people just become a little bit lazier, sloppy, and then maybe by the third month, and people just give up their original goal. Yeah. So over the years, in our life, we set many flags, but we really don't really, stick to that. Yeah.
Yeah.
So I think continued effort, that's very important.
And then, what advice would you give to people for them to maintain a good general health?
Okay, so people should have a goal. If you don't have a goal, you don't know how hard you should work toward the goal. So a lot of people say, "Oh, I study and then get some certain grade, and then I go to a better school and then a better job." And if you enjoy life, and then you have to think about how you can enjoy and for much longer. So for me, I was joking with my other patient, a doctor can never make a lot of money, right? In order to accumulate more wealth, and then, I want to work for many more years. So my goal is to work up to maybe 100 years old.
Oh.
Okay. So in order to achieve this goal, I need to live healthier and happier life, and then so I can prepare for maybe next 30, 50 years. So make sure I can perform my job. Yeah.
Wow. All right, last one for fun.
Yeah.
I keep seeing that girl. Is she actually one of your patients?
Yeah. No. Actually, they came in, got needles, and they probably can be my patient. But every year, end of probably like around winter time, maybe late fall. So we invite some young kids to come in to experiment, to try acupuncture versus regular vaccine shots. So like a prevention of flu or maybe COVID. So we try if they in the past they try like regular vaccines. So this year they want to try acupuncture, and then we see if they get sick, or sicker.
Oh.
Yeah. So because this is one way practice because patient had like a sickness, flu or COVID. By the way, I have treated so many patients with COVID, and I'm okay, and a lot of patients, just after one session or two sessions, they recovered. So the medicine works for a lot of conditions like this, and I think we should promote the medicine and also be a really important part in the prevention.
Okay. Thank you.
Right.